Hi, this is Jessica DaMassa with WTF Health. I am here at Upgraded Life Festival in Helsinki, Finland. And joining me right now, I actually have the head of Upgraded Life. This is Nygård, and she has put together a fantabulous event here. So tell me a little bit about what you guys talk about here and why this is so important to have in Finland.
Thank you. So actually Upgraded Life Festival is done now for the 5th time already. So it started 5 years ago of the need of bringing the health startups and innovations closer to the hospital area and to the end users, who usually are doctors and nurses. So how can we provide on a silver platter all the innovation to the people who are going to use it one day? So we wanted to organize an event here in the hospital area in Helsinki. And today we had here almost 800 people who were walking around and checking the new innovations from the demo stands, listening to speeches about different hot topics, and of course changing business cards and networking.
Yeah, of course. So I mean, we really literally are here in a hospital and have been, and it's been really incredible to have this setting around this conversation. So for those who are not familiar with your program, give us like a little bit of a flavor of what it is that you talk about at Upgraded Life. Like, what's the nature of the conversation?
So it's very educational. So we try to give some food for thoughts for people, and that they really, because really learn, and the audience is really high educated.
Yes.
So for example, bioprinting was one hot topic today.
Yes.
Then there has been VR, AR, artificial intelligence is one big thing that is growing. Then of course work-related well-being and how you can take care of yourself during the normal work day or even home in the evening, and kind of there's a lot of insurance companies who are coming into the scene as well and want to prevent people to get actually sick and try to have some prevention methods to keep people healthy.
Okay. Yes. Well, this is literally coming down around us, but that's okay. We're going to keep going. So one of the things I was really impressed with in your program was you've integrated like design. And so I spoke with some of the people who were on one of the design panels. And in Finland, I know you're known for having great design. So why is it important to bring perspectives like that are maybe atypical in a healthcare conversation? Why is it important to have them here?
It's very important because of exactly this perspective of the end users. So how can apps, how can hospitals, how can everything be designed so it's the best for the patient or for the caregivers, for family members. We have now just a few weeks ago opened a new children's hospital here, which has actually been designed with the help of the chronically diseased families of the kids who are in the hospital. So they have been in the process and giving out the ideas of the design, how to make it nice, and how they're going to be there for many months. How can they actually feel comfortable there? So,
I mean, in Upgraded Life, you play a role of bringing together all of the different types of innovators in healthcare here in Finland. So I'm curious, as the head of the conference and as somebody who brings all of these people together, for those watching who are not from Europe or from the U.S. or Australia or Singapore, I mean, we have a global audience. So tell me, what do they need to know about the healthcare innovation space here in Finland? Give us a little bit of a rundown. What do you see?
So we have a very long history with research and public healthcare here in Finland. And because of that, there's a lot of solutions within health, but also the tech scene in Finland has been going on for a long time. And thanks to companies like Nokia, there's really great tech people who have now came together with the health scene, and for example, there's a lot of solutions that help the patients to feel better, but also measuring stress and all these kind of solutions. A lot of platforms that are using AI and.
Okay, what about startups? So I saw that you had a whole startup village that is right now being dismantled behind us. Yes. So what about the startup scene here? What areas do you think the Finns are very strong in terms of like new innovations, and what kind of companies are we seeing come out of Finland?
Yes, so recently a lot of from preventive and health promotive side has been coming up. But there's a lot of from the biobanks, for example, genetics is very hot in Finland. We have a long history of recording the genetics of the people. So that's something that how you can check your own genes at home, do some home testing and this kind of thing. That's really hot. And today actually we had a tour to the biobank, which is here in the same hospital area. Yeah. So our visitors could walk around and go and visit and talk to the people who work in the biobank and get the dialogue opened.
Oh, that's cool. Yeah. Very cool. And then on the investment side, I mean, you obviously have like a VC community here in Finland. How would you describe that? What are they focused on? What types of startups do they typically invest in? What's typical in terms of the amount of like the dollar value of round or how they participate?
Yeah, so digital health is of course something that is really interesting here in Finland. We do, of course, need some help from the abroad investors as well, from people to come here and invest in the Finnish companies as well, because there's not enough capital here in Finland.
Okay.
But yeah, digital health is definitely something that people are looking into. But we do have a lot of doctors who are becoming angels and in that way supporting and giving their comments, but also giving some financial support to the startups. So
very cool. So you mentioned angels, and I want to ask something. So earlier we heard someone had said that really where Finland needs some help from investors is on that early round funding. Would you agree, or do you think that it's really is it somewhere else in the funding spectrum, like from A to B, or what would you say would be like where you are looking mostly for investors?
It's in the later stage.
In the later stage.
Yes, exactly. So we have from the public side, we have a good starting money you can get and the support from the public side. And the early stage companies usually they do okay. But then in the later stage, when the bigger money comes into the picture, that's when we start needing some foreign help as well. So that's why we do the collaboration here in the event to bring investors from Nordics, from Europe, from USA. So in that way, it's nice to see the global network growing.
Definitely. Okay, so anybody who wants to attend Upgraded Life, it is usually what time of year? Where do they find out about it? Tell us.
Yes, so it's always organized in the spring, usually April, May. And it's a nice way to kind of, here in the Finland also, to bring the whole ecosystem together from Finnish, Nordic, Estonian market and celebrate and see one more time before everyone leaves for the nice and well-deserved summer vacations.
Well, I won't hold you for one more minute from yours. Thank you so much for joining me. It was a pleasure to talk to you and a pleasure to be here. Oh my gosh, no, so excited to talk to all of these wonderful people here in Finland about what's going on in health innovation. Thank you.
Thank you.
Thank you. This is Jessica DaMassa with WTF Health from Upgraded Life Festival. Thanks.